Hi there. I'm Dr. David Haase, and I'm the medical director at the MaxWell Clinic. And one of our patients asked one of our physicians yesterday, why should I get neurofeedback done at the MaxWell Clinic? There are other places that you can have this done. And I thought that was a really great question. And so I thought I'd step back for a second and go through the process of how one understands neurofeedback and kind of what's the dark side, the gray side, and the light side, and understand better how to engage this process. So, first of all, neurofeedback is a really remarkable technology. I've seen it change many lives over the last 12 years that I've been engaged in this science and practice. If you have not heard about neurofeedback, check the notes below, and there's going to be other videos detailing how training brain waves can improve your health. So many people have not even heard about neurofeedback, but once you have and you begin to look into it online, it becomes a dizzying adventure of marketing, messaging, and really far too little medicine. There are many problems that you should understand and questions you should have answered by your neurofeedback provider before letting them put electrodes on your head. I'm going to go through several of these now. But before I do, why am I qualified to give you this overview? And that's a really good question that you should always ask before you are going to take information from a source, especially if that information may lead you to engage in the medical treatment of your body and brain. So myself, I'm a Vanderbilt and Mayo Clinic trained double-boarded physician with over 20 years experience in progressive medical technologies. I have over 12 years experience in the field of quantitative EEG and neurofeedback, and I've cared for many patients. My patients have really ran the gamut from prisoners to veterans to athletes in the NFL to NHL, NBA, Major League Soccer, MMA, music stars, television stars, surgeons, lawyers, engineers, legislators, and many mothers and children and fathers and loved ones that really all have in common that they're suffering from having a brain that is not working at its full potential. Most of our neurofeedback patients come from word of mouth recommendations because of results obtained from friends and family that we've treated. And this is really one of the first public teachings I've done on the matter. I am a member of the International Society for Neurofeedback Research. That's the group of neurofeedback nerds. I'm also certified by the Biofeedback Certification International Alliance in neurofeedback and quantitative EEG. I have organized and I taught which is so far the really only U.S. medical school associated course for physicians on quantitative EEG and neurofeedback. I was the first doctor to integrate neurofeedback into functional medicine, taking care of both the soup, which is the biochemistry, and the spark, which is the electricity of the brain. And I'm very happy to see many other clinicians have followed down this pathway. I've recommended specs for EEG amplifiers, helped design EEG software, and created reports for physicians that analyze and summarize the huge amounts of data that an EEG can deliver. I have taught thousands of physicians and health professionals about EEG and neurofeedback across the nation and around the world over the last 10 years. And I'm been mentored by a broad array of leaders in this 50-year-old field. I don't follow the teaching of any one guru that says they have it figured out. I'm really too seasoned to believe that any one technology can provide that, and maybe more than a bit skeptical of anybody that says they have it all figured out when it comes to the brain. So, okay, that was really long-winded, but I wanted you to know my background because I'm going to speak very plainly about neurofeedback, both, as I said, the light, the gray, and the dark side. So first of all, the light side, what I've witnessed, which is a lot of meaningful long-term changes in brain function for people. I've witnessed individuals 20 years after a major head injury have a return to 80% of normal function from behavior as a 10-year-old essentially to a functioning adult in a family situation. I have witnessed individuals with severe anxiety having it shed, being able to concentrate on their family and their work and not be caught in those rumination patterns of their head. I've seen individuals that have been plagued with PTSD shift out of that chronic ruminative and high alert pattern. Individuals with autism and Asperger's have improved their social interactions and their engagement with the world. Even gotten to witness verbalization coming back in an autistic patient, and a Asperger's individual starting to express emotions for the very first time in their life. I've seen depression subside and stay better over the course of a decade. Improvement in symptoms of individuals with schizophrenia, and even decrease in the sundowning behaviors of individuals with dementia. I've witnessed pain perception diminishing, and learning disabilities diminish. Attention disorders essentially evaporate, so that that individual has as normal of attention span as any of their neurotypical colleagues. I've witnessed this and a whole lot more as having improvement. I think neurofeedback has tremendous potential. It is plagued with not having enough data, and having many different amplifiers, many different technologies, many different software platforms, many different practitioners, and not enough group data to give us as much certainty as we want in this field. And I think that's just really the honest truth of where we are. I like neurofeedback because it's a very safe therapy, and it should be a very safe therapy because the only thing that's happening in your brain is that it's learning. The computer watches your brain waves, and when your brain does what's desirable, you or the patient in this case gets a reward in the form of some kind of visual or auditory stimulation. Some type of a light and sound excites the brain because the brain likes new information. So that's a reward for it. And oftentimes this reward of light and sound stimulation can come like a movie or a video game playing, or tones playing in the ear, or even in some cases having like a vibrating toy, to like a stuffed animal for children, so they can have a tactile feedback. So when the brain does what we want to reinforce, the individual gets a reward, and that causes a reinforcement of the brainwave patterns that are desired. And since neurofeedback is learning, the more frequently you repeat it, the quicker you learn. But the longer you do the therapy, literally less you need the therapy because you're learning the tasks that are present for you to accomplish. So I say that because it's very important to distinguish neurofeedback from stimulation methods. So stimulation uses specific doses and wavelengths of pulsed light, pulse sound, electricity, magnetism to push the brain into a particular state. Where neurofeedback is learning, stimulation is more like a drug that pushes the brain into a particular state. Now, that can be really useful, and I have a lot of experience utilizing these systems. I recommend them to patients in certain situations, and oftentimes they can be a great aid in sleep and relaxation, anxiety, but I don't expect them to be a long-term fix. And I'm very passionate about finding underlying causes of illness and seeing health restored for the long term in patients. It may take a bit more work, but we want the individual to have a perpetual state of higher functioning as a result of our therapies, as opposed to need continued support. So now, one of these systems often try to kind of avoid the scrutiny of the FDA by marketing themselves as neurofeedback rather than neurostimulation, to avoid kind of the far more rigorous oversight that devices that push the brain are really required and should have. So anyway, that's kind of the light side. The gray side, neurofeedback is not a cure-all or even a cure most. There are many reasons a person can have a brain problem. And brain problems can be memory, concentration, learning, movement disorders, behavioral problems, attitude issues, mood instability. All of these problems can have biochemical foundations, psychological foundations, sociological foundations, genetic, dietary, lifestyle, structural. It really, if you have a brain issue, and most medical problems, if you really examine them, have a substantial brain component. If you have a brain problem, a thorough brain/medical evaluation that precedes diving into neurofeedback is necessary to prevent, it being a waste of time, money, and effort that really, as a result of the wrong treatment being applied at that time. But also, we also want to avoid the suffering that inappropriate treatment or delayed treatment causes by not getting the treatment one needs. So evaluation is critical. Diagnosis is critical. Understanding who you are, what your goals are, and what is important in life is exceedingly important. And because you get to make those decisions. You as the patient need to be in control of your health. And no more so than when you're working to improve the functioning of your own brain. So now some kind of the dark side. Neurofeedback, you may be surprised, but legally requires no medical training, no licensure, no certification whatsoever to market and provide it to people. It is completely buyer beware in these circumstances. I've seen patients that have been diagnosed and treated by neurofeedback by medical experts, such as hairdressers, pharmaceutical sales reps, engineers, by these all-in-one black box systems with really their only training being that of the sales team that sold them the device or the franchise that sold them the methodology and the business plan. Now that's being pretty obnoxious, and that's the worst end of the scale. Most people who come into this field have great hearts and great intentions at helping the world, and I think neurofeedback is a very safe therapy in general, but it still requires us to honor the brain and honor the real full scope of who this person is as a human, and not just recognize that if you're only tool is a hammer, everything becomes a nail. So, this is the brain we're dealing with. I'm biased because I hold a medical degree and a license to practice medicine, but I think it's important that we examine the licensure, the training, the experience, and the background of individuals you're giving permission to change your brain. Since there's no mandated training or certification, the other letters behind somebody's name that are regulated can be really helpful. Many PhDs are neuropsychologists, psychologists, sociologists, family therapists, can be excellent resources along with medical professionals as it applies to neurofeedback. So neurofeedback is interesting also in that it has slipped outside the regulation of the FDA as it regards the manufacturing of biofeedback systems, using something kind of a Me Too exemption. We call it 501 or 510K exempt. EEG, which are the electroencephalogram, the brainwave amplifiers that are used for neurofeedback, are exempt from FDA regulation. In these cases, you don't know what you're getting. I really recommend if you're having EEG diagnostics done or EEG neurofeedback, have amplifiers that have gone through FDA clearance or are FDA certified as diagnostic tools. Neurofeedback is not a sexy marketing term, and many brain therapies are being marketed under fancy names that are actually neurofeedback. Things like brain balancing, brain resetting, brain tuning, brain painting. I mean, and I'm not picking on any one company or person that uses these terms. Heck, I've used these terms in the past to help people understand what neurofeedback is. But when the terms are used to avoid the medical term of neurofeedback, that's kind of deceptive. The more precise term is actually brain-computer interface technology, but that's even less marketable than neurofeedback. So, neurofeedback is accomplished by putting an electrode, a sensor, on the head and measuring the brain waves. The brain is complex. There's lots of signaling going on across the whole brain. So before you go messing with your brain waves, get your brain waves examined over your whole head from many different directions and many different ways. What's that old saying? Measure twice, but cut once. It's important here because diagnosis should always come before treatment, especially when it comes to your brain. The good news is no cutting is going on at all, so we have a lot less to worry about. The EEG, or the brain evaluation they do in MaxWell Clinic, measures using 19 different electrodes. So these are 19 different sensors that look like they're embedded in a shower cap. I actually have one here, and so this is what the shower cap looks like. And there's an individual wire attached to each one of these sensors. The cap is put on, and let's just put the cap on right now. Why not? It's always a little challenge to find which is the front here. There we go. So neurofeedback requires the accurate placing of electrodes so that you have an ability to know where the brain waves are coming from. And unfortunately, I don't have a video feed of my actual, I don't have a video feed of what's going on right now, so I'm not actually sure if this is in the right place. But so there we go. F1, F2 are in the right place. About that. So the placement of your EEG electrodes is something that we train our technicians to do. There are courses to understand how to do EEG acquisition. But what this 19 electrode array does for you is that it allows us to simultaneously measure all parts of the brain that are going on. We measure the brain waves when the eyes are open, when the eyes are closed, when the individual is completing a difficult brain task. We do objective measurements of impulsivity, distractibility, persistence, and processing speed by giving individuals a difficult, continuous performance task while they're wearing this cap. We also simultaneously measure the autonomic nervous system, that is our fight or flight system, and measure the speed and the power of brain waves that regulate vision, attention, and processing speed. Those are called event-related potentials, and it gives and they're highly reproducible and give a lot of information about brain function. We then take all that information, we compare the patient's brain waves against one or several different normative, FDA-registered, or peak performance databases. This is what lets us know what type of brain pattern uniquenesses are present in that individual that represent inefficiencies. And then we take all that information and we use the opposite of kind of a global positioning software to triangulate where all the electricity in your brain is coming from. And then we get a map of the electrical function of the inside of the brain. It looks like slices of a CT scan. But what we're seeing is not the structure of the brain, but where is electricity coming from? A functional connectome. It's a complex process and it's a lot of work, but we're working with the most complex structure in the known universe, the structure that holds your sense of self. Yeah, wow. I mean, it holds your sense of self, your dreams, your capabilities, your future. And I think it demands of us that we do our best to assure safety and efficacy when in any way possible. So I want to contrast getting information in this standardized three-dimensional way with placing a couple of leads on the head, maybe a couple here or a couple here, maybe 2 or 4 individual leads, or moving the wires around the head, or possibly not just measuring and or possibly just allowing the computer to both diagnose and treat, what we kind of call a black box system, which I don't trust black boxes yet. I don't think the data and the science is there. I can't wait for it to be there. I think we will get there, but I've analyzed a lot of technologies, and it's not what I want yet for my own head. So just as accurate diagnosis is aided by these 19-channel EEGs, treatment, I found, is faster and more precise when we actually do neurofeedback with these multiple leads. And so if you put a single lead on the head, for instance, if I was going to train FP2 here, this sensor would be recognizing the brain waves that are under that part of the head. The computer would watch those brain waves occur. When the brain waves matched what we want to reinforce, I would be stimulated somehow. I would be shown a movie that's bright and loud. And when my brain waves do what we don't want to reinforce, the movie would get dark and quiet. And because my brain wants to watch the movie, we would figure out the electrical combination lock to make the movie play by making more electrical activity under this lead. But the brain doesn't really work on just a single spot. The brain has a network of networks of activities, and it's all working all the time. And so if we just train one particular lead and we say, okay, reward if they make more of this brainwave or less of this brainwave, sometimes you can overshoot. And those overshoots can cause call ab reactions or side effects. And so I think that it's important to recognize that the brain is one of the most complex system that we have. We should treat it as a system, not in a linear fashion with a single intervention. So when this whole cap is present and the software can enable a 3-dimensional multi-location training that we have observed, and we've observed this decreases the number of training episodes. Now, that's good because training takes time, it takes money, it takes effort, and anything that we can do to improve outcomes and decrease cost is a welcome thing for all concerned. So now, we absolutely need more research in neurofeedback. This is not a patentable therapy. And so there's no large drug company, there's no large medical diagnostic company that is lining up to do the studies to show which form of neurofeedback works the best, because it can easily be copied from one company to the next. And also there are not adequate billing codes present that have come from something called CPT, which is controlled by the AMA. And a lack of those billing codes make it hard to actually bill insurance for this process or to get paid through any type of an insurance plan or process. And even if you have those codes, it takes time for that to occur. So there's a lot of systems resistance against neurofeedback, but it's slowly moving forward, and hopefully those codes will be coming soon. So anybody out there who is independently wealthy and wants to fund research in neurofeedback, I have a personal dream that I would like to study the quantitative EEG and provide neurofeedback for first-time jail offenders, individuals who are making it into jail the first time, offer it as a study and randomize the trial. So some get neurofeedback, some get a sham neurofeedback, some get just counseling. Just all good things. And then see, can we decrease the number of individuals that have recidivism, re-enter jail? Now, because I really believe that it's a lot of what occurs, are the poor judgments that are often made, or the impulsivity that pushes one towards violence or crime, has a lot to do with how good of a brain you have. And if we can improve the brains of our society, I think everybody will be served. But so that was a tangent. So if any incredibly wealthy individuals out there would like to do some public good, I've got a proposal for you. So let me kind of pull this together. I said, if your only tool's a hammer, everything becomes a nail. If the location you're looking at, or the group you're looking at to do neurofeedback, only has one way of doing things, that's a red flag in my opinion. We have 9 amplifiers in our clinic. Amplifiers can be as small as something like this. This has the most advanced chip present from Hewlett-Packard right now for EEG analysis. And this EEG amplifier, plugs into the end of this cap, and then the amplified and sorted data is sent to the computer system. But we have 9 different amplifiers from 4 different companies, several different software packages, several different databases to customize treatment to the concern at hand. And MaxWell Clinic is often the place where people come after other brain interventions that are run by less seasoned individuals have caused harm, and we really work to reverse those situations. So in summary, know who is diagnosing and treating. Ask for qualifications, certifications, training. Get a full CAP EEG for diagnosis, please. That can be referenced against multiple databases. Be comfortable with the technology that you choose, the method of treatment you choose, and the environment in which that's taking place. Make certain you've taken into account your brain and your body biochemistry and your psychological challenges so that you're addressing the best possible combination of therapies to enable the best brain for yourself. Be clear about your goals for treatment and choose as wisely as you can, because you are in charge of your health care. There are many excellent neurofeedback practitioners out there doing great work. I suggest you search for providers at the academic site isnr.org. That's I, S as in Sam, N as in Nancy, R as in Ralph.org, as this is really the place where, we nerds of neurofeedback congregate. I encourage you, get 19-channel neurofeedback done if you can. Yes, what does the cap do? It messes up your hair. And I have kind of chuckled sometimes when individuals will say that that's their pushback to doing full cap neurofeedback. And I think your brain is worse than messy hair. We can wash out the little bit of electrode gel that goes in the brain, or goes in the cap that's on your hair, and your brain will be better for it. So if we have the opportunity to serve you at MaxWell Clinic, we'd be delighted to care for you and your brain to the very best of our ability. So I'm Dr. David Haase. I wish you wellness.